So let's take a look around our hospital with VR photos. You can see the picture of our hospital in the background. The white building, something we call Building 1, is the oldest building of our hospital, built in 2003. And the new building, Building 2, was added just at one side of the old one in 2013. And of course, the two are connected. We offer high-quality medical services through 35 clinical departments and 12 specialized centers, seeing more than 6,500 outpatients daily. And this is what our typical outpatient clinic looks like. On arrival at the outpatient clinic, patients will be required to complete a registration at a reception desk. Our nurse will then take several measurements, such as vital signs, height, and weight of the patient. And those data are automatically transferred to the electronic medical record system, so we can establish a baseline for further observations of the patient at arrival. And after registration, patients can see their name is on the list of this dashboard. It tells them where their doctor's room is, how many patients are waiting, and when their turn will be. And there is seating for patients while they wait for their appointments. And also, there are smaller waiting areas near the consulting rooms. And this monitor in front of the consulting room displays doctor's name, the patient currently in the room, and the next 3 in line waiting patients. And this is the view inside the consulting room. Now let's take a look around our inpatient wards. We carry more than 1,300 bed capacity, and we have a variety of options for accommodation of patients, from VIP ward to general wards, ranging from single to 5-person multi-bedrooms. And this is our VIP ward located on the 11th floor, the top floor of the Building 2. There are 14 rooms, and all of the rooms are private and spacious. And inside the room, you can see a patient bed, a sofa bed for caregiver, a separate toilet and bathroom, and work table, television, and also there is a separate room for caregiver with a mini kitchen and toilet. Most foreign patients are admitted to this VIP room unless the patient needs close monitoring in the specialty ward. And specialty wards or general wards consist of a mix of single, double, and multi-bedrooms. And of course, in multi-bedrooms, all beds are partitioned with a curtain to maintain patient privacy. And all inpatient wards have a 55-inch large touchscreen-based display board showing all the clinical data on a single screen with a glance view to facilitate ease of understanding and mutual communication between healthcare personnel and even with patients and their family members. Now let's move to the operating room. Our operating room is located on the 3rd floor of Building 1 and Building 2. And this is our pre-op holding area. Soon after patients are brought to this area, OR staffs will take a short time out to complete a final check immediately before surgery begins. And when the surgeon and operating room are ready for the patient will be wheeled on a stretcher into the operating room. We have 38 operating rooms, and we have a system that allows surgery to be live streamed around the world using virtual reality technology. Our surgeons are recognized nationally and internationally as experts in their fields. So we are not only dedicated to providing patients the best clinical outcomes and in offering the latest techniques and technology, but also we ensuring that we continue to progress and teach the next generation next generation of surgeons as well. Of the 38 operating rooms, 4 are dedicated to robotic surgery. So this is our robotic suite, and here's our robot. During the procedures, surgeons sit at a console which gives them a three-dimensional view of operating field and use handles to make movements, which the robotic arms then mirror. And we are utilizing the robot for a variety of procedures in various surgical specialties, such as urology, gynecology, thoracic surgery, general surgery, and currently head and neck surgery. And we've already achieved more than 5,000 cases of urologic surgery with Da Vinci robots in 2019. And this is our hybrid operating room equipped with a built-in C-arm X-ray that allows surgeons, radiologists, and other providers to use real-time images while performing complex surgeries. And the types of procedures performed in a hybrid operating room are typically cardiac, vascular, and neurosurgery, but the variety and number of procedures are growing rapidly. When the surgery is completed, patient will be moved to the recovery room and closely monitored until he or she is awake enough to go back to the ward. And here, the empty space next to the monitoring equipment is where the patient will be placed and monitored. Next, intensive care units. We have 8 separate specialized intensive care units with over 100 beds, and typically one nurse cares for 2 to 3 patients. In this image, you can see a typical intensive care bed space. So each bed has bedside monitoring machine that can provide a continuous display on the central patient monitor in the nurse station. So nurses can monitor vital signs and advanced parameters all on one screen and can immediately respond to the patient's status change. Our ICU beds are available to provide mechanical ventilation, percutaneous tracheostomy, hemodialysis, CRRT, ECMO, bronchoscopy, bedside echocardiography, EEG, and many other ultrasound-guided complex procedures. And we have a special interventional suite directly on the neuro ICU where mobile brain CT can be performed. And intensive care patients with head injuries depend on fast, reliable imaging results, so rapid diagnostic performance is very important for them. That's why we made a special interventional suite directly on the neuro ICU. So the patient remains constantly connected to monitoring and medication supply at his or her bedside during the CT scan and no longer need to leave the ICU for transportation to the radiology department. And lastly, let's move on to the emergency center. Our emergency center is located on the first floor of Building 2 where you can see the right after entering the front driveway of our hospital. And this is our ambulance bay where we can accommodate up to 5 ambulances at a time. And after MERS outbreak in 2015, all Korean hospitals have a strict set of rules to prevent the spread of infectious disease in their facilities. So all ER visitors should be screened for potential infectious disease before entering the emergency room at a separate space. So here we have a separate screening booth right outside the emergency room. And those who are not suspected of infectious disease can enter the emergency room and go through the usual registration process. But patients suspected to be infectious are sent to the isolated space, separating them from general patients, and then receive proper management in that isolated space. And this is our intake area where we can quickly create the patient ID and place an armband. And this is our triage area where patients will be assessed upon arrival. And based on that assessment, the urgency of illness, patients will be brought to the different colored zones of the ER that best fit their needs. So the most acutely ill are sent to the red zone, and the orange zone is for intermediate cases. And those with minor conditions such as sprained ankles or red eyes are examined and treated in the green zone. And the yellow zone is for the pediatric patients. We have 42 beds in our emergency room, and we have a 4-bed equipped ER dedicated intensive care unit. And not shown here, but right up the emergency room, we have an emergency observation unit with 30 beds to provide care or continued evaluation of patients who typically do not meet inpatient admission status, but may need continued monitoring before leaving the emergency room or be admitted to the hospital. And we have a 1 large resuscitation room with 2 beds. And we have 5 isolation rooms in the emergency room, and 2 are equipped with negative pressure air ventilation system. And our emergency room has its own laboratory unit and radiology unit for faster and easier testing. So our emergency center was appointed as the Regional Emergency Medical Center by the Korean Ministry of Health and Welfare in 2015. It means that we have a pivotal role in performing final treatment of severe emergency patients requiring high level of medical care, and also in reinforcing a regional-based emergency medical system. So that's all I had for this presentation, and so far we will have looked around most of the main facilities of our hospital. I hope you have enjoyed this virtual tour, and thank you for your attention.